You must be Mr. Skunka.
Skunsa.
Nice to meet you.
Mr. Rykov?
Yes.
Okay. Do you know who I am?
Guidance counselor?
Not exactly. I'm a school social worker and I'm the substance awareness coordinator. Do you have any idea what that is?
You're aware of substances?
No, that's clever, very clever. I am the person who, anytime there's suspicion that a student may be using drugs or alcohol in the school, I have to interview them and determine whether or not that's the case. You were sent to me because a teacher was concerned because you were sleeping in class, and there were also some other things that were given to me by teachers which give us reasonable suspicion to conclude that you may be, using drugs. Okay, so I have to talk to you about that. And could you please take off your sunglasses? Thank you.
Concentration camp.
Excuse me?
It's like I fell asleep in class once. It's not like I don't know what I was doing.
Okay, well, there's no reason to be disrespectful.
I know, but it's like.
Okay, I'm explaining to you what I have to do as my job, and also there are some concerns. Here's a picture that your art teacher had brought me. This is Jimi Hendrix. Clearly, it's good. Well done. But I mean, there's something coming out of his mouth which really looks like marijuana.
I just feel like I'm being accused for what? This is just a picture. I mean, everything that I've done, I don't see anything wrong with it. It's a picture we did for art class. Okay. This is a pop icon. I mean, a rock icon.
Okay.
He always has something in his mouth. I just did a copy of a picture. Why does that say anything about me personally? It's
well, it doesn't
art.
necessarily say something about you personally, but these are all factors which can indicate that there is drug use. And also, some rolling papers were found, which could indicate that what a rolling paper is usually associated with.
I smoke cigarettes. I roll my own cigarettes.
Okay, well, that's not too common. Usually people who have rolling paper smoke marijuana. So I need to search your bag to see, okay?
It's like the third time today.
Oh, look at this. What's this?
My tobacco.
Natural American Spirit. It is tobacco. That's interesting. Okay, so I guess that pans out. You do smoke. What's this? Oh, this looks like a container for something. There's no Listerine. I don't know what that's for. I don't know why you need that, but okay.
It's like my personal privacy is being completely invaded off of some premise that.
Well, there are several factors here. And that's reasonable suspicion. We have
only reasonably explained.
Okay.
I fell asleep in class. It could have had something to do with the fact that maybe I didn't sleep last night because maybe I
could have
problems at home. I could have just a stupid picture that I drew in class. Maybe I chose the wrong picture. Like,
okay. Also, some people say that some of the kids you hang around with are known drug users. There's enough for us as a school to say that you need to be sent out for drug testing. Okay, and if, as you say, you don't use drugs, then everything will be fine. The results will come back, and everything will be fine. We'll talk about it. You can tell me about some problems that you're having. If you want to talk, I'm a social worker. We can talk about that. But first, we always have to rule out the possibility of substance abuse. Okay?
I just feel like I'm being persecuted for nothing, and it's like
persecuted.
It's just unfair. Like, why do I have to get sent out for drug testing because I fell asleep in class?
Well, look, I'm going to have to call your parents. They have to take you within 2 hours to the emergency room, okay? When the results come back, then we'll talk about it.
All this because I fell asleep in class?
Well, it's not just for falling asleep in class. Several other factors here.
But the other factors are all reasonably explained.
They are, but they still are enough for reasonable cause. Reasonable suspicion that you're using drugs, okay? Yes, you have something in there which I may have to turn over to the police, which could have residues of marijuana in there, which indicate that you're smoking marijuana.
I don't smoke marijuana. I have panic attacks, and I do not smoke because it does not help me out with my panic attacks.
Okay, well, that'll all be seen. Okay.
I don't like drugs, and I don't. That's not what I'm about.
That's what a lot of people say, and that may be true. Okay, I'm not. You're not. You're not. I'm not saying that you are, but I'm saying we have reasonable suspicion. Come in.
You again?
Mr. Rykov. How do you pronounce that?
Rykov.
Rykov?
Mr. Skunka?
Skunsa.
Skunsa?
Yes. Okay. I got your drug test results back.
And I told you I didn't smoke.
Well, actually, the results are kind of surprising to me. And yes, perhaps you don't, because you came out negative for THC, which is marijuana. But you came out positive for opioids and benzodiazepines. Now, do you know what those are?
I know what opioids are, I guess.
Okay.
Pain reliever kind of thing.
Right. And benzodiazepines are anti-anxiety.
I told you I had anxiety.
Right, but you didn't tell me you were prescribed any medication.
Well, what's the big deal? I mean, I'm prescribed medication for anxiety and...
Well, I see. Okay, since we've sent you out and we have this information, now we have to pursue this because this is showing that you're using substances. However, if you are able to provide me with a psychiatrist's name, with the doctor's name that prescribed it, then it's fine. Can you do that?
You guys made an assumption that I smoked marijuana. I went out to do testing. And now you're freaking... This is unbelievable. I mean, I didn't really do anything. Like, I'm prescribed as medication. You were testing me for other substances. And now you're telling me that I'm in trouble because I'm being prescribed medication?
That's not... I need to know for sure that you are not abusing these substances. If you tell me that you are prescribed them, I need some proof of that, okay?
This is ridiculous.
Well, I'm sorry that you feel that way, but I am going to have to call your parents, and you're going to be out of school until you're able to provide me with this information.
But you guys made an assumption about something else, and now I'm in trouble for... It's just like, I don't understand. Like, this is like, you're just kind of digging for... trying to find a way to screw me over. I didn't do anything wrong. Well... In the first place. This is such a hassle.
You're getting very upset.
Because this is upsetting. It's like...
If everything is fine, and if you have the... Why would you be upset?
Because I'm being harassed.
Well, that's... I'm sorry that you feel that way about it. I'm sorry that you see it that way, but it's not harassment. This is the policy of the school, and it's also based on the state law.
It's freaking bull, man. Either way. It really is. It's like, I didn't do anything wrong.
Okay, well, you can't just leave, okay?
What do you want me to do?
have to call your parents, okay?
Call my parents.
Excuse me, Mr. Rick.